Methotrexate, also known as Jylamvo 2 mg per milliliter oral solution folate antagonists, is a medication used to treat certain types of cancer, such as acute lymphoblastic leukemia and non-Hodgkin's lymphoma. It is also used to control severe psoriasis or rheumatoid arthritis that has not responded to other treatments. Additionally, it may be used to control juvenile rheumatoid arthritis. Methotrexate belongs to a class of drugs known as antimetabolites and works by slowing or stopping the growth of cancer cells and suppressing the immune system. Early treatment of rheumatoid arthritis with more aggressive therapy such as methotrexate helps to reduce further joint damage and to preserve joint function. The recommended daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. Before starting to take Jylamvo 2 mg per milliliter oral solution folate antagonists, it's important to read the patient information leaflet from your pharmacist. If you have any questions, be sure to ask your doctor or pharmacist. The dosage and frequency of taking Jylamvo are determined by your medical condition and how you respond to treatment. It's crucial to follow your doctor's instructions carefully to avoid serious side effects. For psoriasis or rheumatoid arthritis treatment, Jylamvo is usually taken once a week and it may take several months to see the full benefit of the drug. If you are using the liquid form of Jylamvo, make sure to measure the dose using a special measuring device/spoon and not a household spoon. It's important not to increase your dose or use the drug more often or for longer than prescribed, as it will not improve your condition any faster and will increase the risk of side effects. For pregnant women or those who may become pregnant, it's important to avoid handling the medication or breathing in the dust from the tablets, as it can harm an unborn baby. Lastly, it's recommended to drink plenty of fluids while taking Jylamvo, unless your doctor advises otherwise. This can help your kidneys remove the drug from your body and reduce the risk of some side effects. Some common side effects of Jylamvo 2 mg per milliliter oral solution folate antagonists include nausea, vomiting, stomach pain, drowsiness, dizziness, and temporary hair loss. These side effects are usually temporary, and normal hair growth should return after treatment has ended. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the risks. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any of the following serious side effects: mouth sores, diarrhea, signs of anemia, signs of liver problems, easy bruising/bleeding, black stools, enlarged glands/lymph nodes, bone pain, unusual pain and discoloration of the skin, signs of kidney problems, dry cough, muscle weakness, weakness on one side of the body, neck stiffness, severe headache, vision changes, irregular heartbeat, mental/mood changes, seizures, or signs of infection. It's also important to note that this medication may lower your ability to fight infections, making you more susceptible to serious infections. If you notice any signs of infection such as a sore throat that doesn't go away, fever, chills, or cough, contact your doctor immediately. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you experience any side effects, you can report them to the FDA in the US or to Health Canada in Canada. Methotrexate is used to treat cancer or severe diseases caused by an overactive immune system, such as psoriasis and rheumatoid arthritis. It can cause serious side effects, including birth defects and death in unborn babies, so women should avoid becoming pregnant while taking this medication. If you have kidney problems or excess body water, you must be closely monitored by your doctor. Methotrexate can also cause severe blood and bone marrow problems and stomach/intestinal disease when used at the same time as certain pain medications. It may also cause liver problems and other serious side effects, so it's important to discuss the risks and benefits of this treatment with your doctor. If you experience symptoms such as irregular heartbeat, low back/side pain, or signs of kidney problems, you should contact your doctor immediately. Additionally, if you are using methotrexate long-term, a liver biopsy is usually recommended. Before taking Jylamvo 2 mg per milliliter oral solution folate antagonists, it's important to talk to your doctor or pharmacist about any allergies you may have or any inactive ingredients that may cause allergic reactions. It's also important to discuss your medical history, including any liver, kidney, or lung disease, alcohol use, suppressed immune system, blood cell or bone marrow disorders, and any active infections. Jylamvo 2 mg per milliliter oral solution folate antagonists may increase your risk of infections, so it's important to avoid contact with people who have easily spread infections like chickenpox, COVID-19, measles, and the flu. It's also important to inform your healthcare professional before receiving any immunizations or vaccinations, and to use caution with sharp objects and contact sports to lower the risk of injury. This medication may cause dizziness or drowsiness, so it's important to avoid alcohol or marijuana, and to use caution when driving or operating machinery. It may also make you more sensitive to the sun, so it's important to limit your time in the sun, use sunscreen, and wear protective clothing. It can also affect fertility in both males and females. Jylamvo 2 mg per milliliter oral solution folate antagonists should not be used during pregnancy and may harm an unborn baby. If you are of childbearing age, it's important to ask about reliable forms of birth control while using this medication and for a period of time after the last dose. It's also important to avoid handling the medication if you are pregnant or may become pregnant, and to avoid breastfeeding while using this medication. It's important to be aware of potential drug interactions with Jylamvo 2 mg per milliliter oral solution folate antagonists. These interactions can affect how well your medications work and may increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include acitretin, asparaginase, chloramphenicol, leflunomide, other drugs that can cause kidney problems, such as cisplatin, other drugs that can cause liver problems, such as azathioprine, sulfasalazine, retinoids such as isotretinoin, penicillins, phenytoin, probenecid, procarbazine, pyrimethamine, sulfa medications, and tetracyclines. It's also important to note that certain drugs that reduce stomach acid, proton pump inhibitors PPIs such as esomeprazole, omeprazole, pantoprazole, may increase the amount of methotrexate in your blood, which can increase the risk of side effects, especially with high-dose methotrexate treatment. Be sure to consult your doctor or pharmacist for details and ways to lessen the risk of side effects. If someone has taken too much Jylamvo 2 mg per milliliter oral solution folate antagonists and is experiencing serious symptoms like passing out or having difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can call the local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as bloody stools. It's important to seek help right away if you or someone else is experiencing these symptoms after taking Jylamvo. It is important not to share this medication with others. Before starting this medication and while taking it, you should undergo various lab and medical tests such as complete blood cell counts, liver and kidney function tests, pregnancy test, and chest X-ray. It is important to keep all medical and lab appointments. Consult your doctor for more details. Remember to take each dose of Jylamvo 2 mg per milliliter oral solution folate antagonists as prescribed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. Timing is important, so make sure to take it at the same time each day for the best results. If you are using the tablet form of Jylamvo 2 mg per milliliter oral solution folate antagonists, make sure to store it at room temperature, away from light and moisture. It's important to keep all medications out of reach of children and pets. For the liquid form of this medication, refer to the product package for specific instructions on how to store it, or ask your pharmacist for guidance. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed. Make sure to properly discard it when it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.